I'm here live at ASN, American Society of Nephrology Kidney Week 2024 in San Diego, California. I'm here to ask the question, what is stopping innovation in kidney care? Over the years in my career, I've seen so much stagnation for the last decade or two, but finally we're seeing things open up. But there's still some impediments to advancing kidney health in America. So I'm here to ask the question of professionals, what is stopping innovation in kidney care?
I think the biggest impediment is just being open to change. I don't think that healthcare systems, our payment systems, and physicians themselves, I don't think we're open to change.
Yeah, absolutely.
And that's where we have to look. I would say our biggest barrier, and I'm a physician, you're a physician, is like, let's first look at ourselves. Let's see, are we aware of what barriers that we have where we're on our own agenda? We have to start thinking about what's the patient's agenda.
Absolutely. There's a lot of barriers in terms of it takes a lot of money to innovate these types of devices. We've been at it for 15 years as a company in the UK. We're just commercially active now, so it gives you a sense of how long that runway is.
Yeah.
Very, very costly to innovate technology. To get it regulatory approved in the US is a huge, huge burden. Like, it takes years where you're not making money. Right, so that's kind of one of the big things blocking innovation, I think, right now with devices like this.
Too much
over
regulation to walk through.
Lots of regulation.
Is the source of data, right? So from a scientific point of view, the larger your N or population, the better.
Yeah.
So when we look at CKD, you have private nephrology practices that may have 2,000 patients, 10,000 patients, but you don't have a number that's 100,000 or 150,000. Even pharma companies don't have that for clinical trials.
Oh, okay.
So getting all those N's together to be able to give you a p-value that is significant, and we know that that's going to drive operational medical changes, is difficult.
But we have policy and payment structures that are slow to change and not as flexible as they need to be. And I think that's the big problem, because when it comes down to who's going to pay for these innovations, we need to update our structures around that. As we get more innovation in, we have to continue to give feedback and use our voices as nephrologists in the policy space to let them know what's working and what isn't.
In general, medtech or any innovation in this space takes long time, long gestation cycle per se.
The regulatory pathway.
Regulatory pathway and clinical pathway, and if you have especially products like our wearable device, where you need to go to the animal studies and the first in human trial, pre-pivotal and pivotal, each study itself will take quite a bit of time. And in order to do all this innovation, you need probably a few, maybe sometimes hundreds of millions of dollars.
Investor. So
investors, and then generally they may not have a long horizon for 5 to 10 years, especially in medtech.
Unfortunately, a lot of industry folks are more worried about the bottom line than the patient, which leads to mistrust and distrust of the medical professionals.
Yeah.
Unfortunately, that's the reality.
Is that the vibe you get from a lot of patients?
I do get that from more than I'd like.
Yeah.
Yeah, definitely. And the other thing is, change for any of us isn't always comfortable.
Yeah.
We like the status quo, so I think that's part of it too.
I've got the same question like you have.
Yeah.
But this question is the reason we stepped in as the Dutch Kidney Foundation. We saw there is a lack of innovation. Dialysis is invented during the Second World War by the Dutchman Willem Kolff.
Oh, wow. Good.
Really?
Yeah.
And we see a lack of innovation, and we exist as a foundation to make the life of the kidney patient better, to give more freedom. So that was the reason we stepped in, and we found partners in Singapore, Switzerland to realize this.
I think a big one is cost, right? We have treatments that work for our patients, but unfortunately many can't access that. I don't know if it's inhibiting innovation, but it's inhibiting access to innovative therapeutics that we know help our patient population, right? So I think that's one. I think the other one is, as physicians, we need to be a little bit more open-minded about industry, right? Like, we're here at ASN surrounded by people that all have the same goal, which is slowing progression and improving clinical outcomes for our patient population.
Some complacency and some building up calluses, getting used to the way we've done things.
Yeah.
And also,
Do you think the bundled payment system we have definitely contributes as well too?
I think that's a no-brainer. Yeah. I mean, when we talk about the cost per treatment, it's hard to make it even with what we've had in the past.
Yeah.
So when we talk about bringing new devices in, new technologies in, things that we haven't seen before, absolutely, there can be some consideration in the reimbursement, the bundle, negotiated rates with different sort of payer plans, these sort of things.
However, I think the model still, certainly in the fee-for-service area, really still focuses around in-center hemodialysis being easier and more efficient from a process perspective than home therapy, than working sometimes through the transplant process. And as a nephrologist, a lot of times you're actually paid more if you do your 4 visits to see an in-center patient than you might if someone gets transplanted or for home therapy. So
Awesome. So the alignment of incentive for the doctors to do things.
Exactly. Do it differently.